The erosion of confidence in vaccines and the decades of misinformation that Secretary Kennedy and others have been spreading has led to diminished vaccination coverage. We are already seeing pediatric measles deaths. We also saw 280 American children die of influenza last year, the vast majority of whom were unvaccinated. That's the highest level of pediatric deaths since the 2009 H1N1 pandemic. If vaccination rates drop, confidence is further eroded, and fewer Americans are vaccinated, we will see an increase in unnecessary deaths. The administration has placed numerous political appointees into agencies like CDC, where they're promoting anti-vaccine ideology and are making decisions that are not based on science and that are not based on evidence, and that is leading to dangerous policies that will cost American lives.
Thank you, Mr. Chairman. Republicans on this subcommittee have spent this year burying their heads in the sand as Secretary Kennedy and President Trump decimate this country's ability to prepare for and respond to future pandemics. America needs to prepare to respond to all health threats, whether it's a virus that jumps from an animal to a human or a bioweapon designed using AI by malicious actors targeting Americans. Instead, because of the lies being told by President Trump and Secretary Kennedy, we are becoming more vulnerable to diseases like measles that are preventable and have been practically eliminated from the United States. Dr. Havers, you resigned from the CDC in protest of Secretary Kennedy's unscientific attacks on vaccines, our best defense in the event of a biological threat. HHS has yet to respond to multiple requests from Democrats related to these dangerous policies. Because Republicans have refused to conduct oversight of Secretary Kennedy's reckless behavior, can you please walk us through what you saw happening at CDC that led to your resignation?
So the Advisory Committee on Immunization Practices plays a critical role in establishing evidence-based, science-based vaccine policy for 340 million Americans. With Secretary Kennedy firing that committee and replacing them with people who are ideologically driven, who are not qualified, and who have an anti-vaccine standpoint, I knew that this committee would be weaponized to further spread anti-vaccine propaganda. We would see falling vaccination rates in the population. We would see an increase in vaccine-preventable deaths, and we will see diseases like measles running rampant throughout the population. All of this has happened. I think since I resigned in June, we've seen a CDC director resign for refusing to rubber stamp in advance recommendations coming out of this committee. We've seen further loss of expertise and further undermining of CDC's reputation. The fact that Secretary Kennedy hijacked a CDC website and put up information linking vaccines to autism on an official government document was a gut punch to everyone who's ever worked at CDC. That was done without scientific review or scientific clearance. And actions like this have undermined CDC's credibility with state and local health partners, with professional medical societies, and with the public.
So hold on, shortly after you resigned, you said that if Secretary Kennedy's undermining of vaccines, quote, isn't stopped and his policies aren't reversed, quote, immediately, a lot of Americans are going to die as a result of vaccine preventable diseases, end quote. What consequences will Secretary Kennedy's crusade against vaccines have for Americans, including if we are faced with a pandemic emergency?
So the erosion of confidence in vaccines and the decades of misinformation that Secretary Kennedy and others have been spreading has led to diminished vaccination coverage. We are already seeing pediatric measles deaths. We also saw 280 American children die of influenza last year, the vast majority of whom were unvaccinated. That's the highest level of pediatric deaths since the 2009 H1N1 pandemic. We're about to enter a flu vaccine, a probably fairly bad flu season, and we have tens of thousands of older Americans who die of influenza every year. If vaccination rates drop, confidence is further eroded, and fewer Americans are vaccinated, we will see an increase in unnecessary deaths. In addition, if we have a pandemic and a safe and effective vaccine is developed and is developed quickly and rolled out, I think the lack of confidence in vaccines will mean that uptake will be lower than it could be, and people will die unnecessarily.
So when Secretary Kennedy took office, he claimed that he would bring with him radical transparency, but this administration and Secretary Kennedy's HHS has refused to answer questions from Congress, repeatedly misled the public about what decisions are being made that affect the nation's health and what evidence, if any, supports these decisions. Dr. Havers, in your testimony, you offer some dire warnings about the consequences of the actions being taken by this administration. I have real concerns that unqualified anti-science individuals continue to be elevated across HHS, including at the FDA, CDC, and NIH. Since Secretary Kennedy has not been transparent, let me ask you instead, is this administration relying on qualified people to make decisions on how to protect the health of Americans?
Absolutely not. The administration has placed numerous political appointees into agencies like CDC, where they're promoting anti-vaccine ideology and are making decisions that are not based on science and that are not based on evidence, and that is leading to dangerous policies that will cost American lives.
Thank you, Dr. Havers. Congressional Republicans have let the Trump administration gut HHS unimpeded. It's deeply disturbing that Republicans have let the chaos unleashed by this administration, which Dr. Havers just described, go unchecked. Thank you, Dr. Havers, for your years of service and for standing up for the health of the American people. With that, I yield back.
Mr. Pallone is recognized for his 5 minutes of questioning.
Thank you. First, Dr. Havers, I want to thank you for your years of service at the CDC and your work as a physician on the front lines of multiple disease outbreaks and pandemics. I am incredibly concerned that the Trump administration is putting the health of Americans at risk by cutting health care coverage, refusing to practice real science, and spreading misinformation and disinformation, particularly about vaccines. So let me ask you, Dr. Havers, is the country at risk of diseases that we had beaten back, measles, polio, chickenpox, coming back again due to the actions of this administration?
Absolutely. We're already seeing this happening.
And as you explained in your testimony, you resigned from the CDC in protest of Secretary Kennedy firing all the members of the Advisory Committee on Immunization Practices, or ACIP. So, Dr. Havers, what impact do the decisions of ACIP have on our country's ability to prevent or respond to public health threats? And what do you think the consequences of the current ACIP's decisions will be on the country's health?
So historically, this committee was very important that there was one immunization schedule for the United States. There were transparent processes where all liaison organizations, for example, the American Academy of Pediatrics or the American College of Physicians, would weigh in, give scientific input. There was a rigorous scientific evidence-based process that occurred before any vote. So this vaccine schedule was trusted universally by clinicians. What we're seeing happening now with a firing of ACIP and the replacement by an ideologically driven committee is that we're seeing not only critical recommendations being taken away, but we're also seeing clinicians being confused, state and local health departments and organizations are coming up with their own vaccine schedules. And this has done incredible damage to CDC's reputation. Trusted partners are now saying we cannot trust CDC because of what this committee has done. Furthermore, doing things like removing the universal hepatitis B birth dose recommendation, which has been in place for more than 30 years and was credited with basically eliminating pediatric hepatitis in hepatitis B in infants and children in the United States. They voted to remove that recommendation. That is going to cost children lives. Like, that will kill. We're going to see preventable deaths occurring. So not only has this administration taken a sledgehammer to CDC's credibility, but they are making decisions that are going to lead directly to an increase in vaccine preventable deaths, while making it much harder for frontline healthcare workers, such as pediatricians, to have conversations about what vaccines should be recommended, why they're recommending something that CDC no longer recommends, because they are doing what is based on science, what is based on evidence, and CDC is no longer issuing recommendations that are based on science.
Well, during the first Trump administration, Operation Warp Speed brought together government, research institutions, and drug manufacturers to quickly develop, manufacture, and deploy COVID-19 vaccines. It was a huge achievement, and I'm worried that if we tried the same thing today, we would not have willing partners in industry, an appropriately resourced research and public health workforce, or a public even willing to take whatever treatment or vaccine is developed. So, Dr. Havers, if we suddenly found ourselves dealing with a new pandemic threat, whether man-made or from nature, are we better off or worse off than we were before COVID-19 because of the actions of the Trump administration?
We are unquestionably worse off.
And if there were a lot of hard-earned lessons from COVID-19, I mean, I think that we all saw, it seems like the Trump administration is hell-bent on ignoring the lessons from COVID-19 and erasing any progress in science and public health. So my last question is, what are the top things that you think the government should be doing to keep Americans healthy and safety that the Trump administration is not currently doing?
Well, this administration needs to move back to policies that are driven by science and not ideology. It needs to invest in public health infrastructure, strengthen local state and local health departments, as well as CDC, and stop attacking experts for science, for making decisions based on science. I think we are definitely, I mean, there are also, as we're hearing, we need to invest heavily in science, not cut NIH grants that could lead to novel innovations that could protect us in the next pandemic. FDA needs to be returned to having a standard regulatory process so that industry and other partners will see the United States as an environment where they can develop novel therapies and then have sort of a standard process that if they meet certain benchmarks, they know it can get approved. I think having an ideologically driven HHS leaderships means that whole environment has been upended. I think we're losing scientists to go abroad. I think innovation and other things will, scientific innovation and research is being ground to a halt. And we are lacking our public health infrastructure that it will allow us to respond to pandemics has been significantly weakened in this administration.
Thank you very much. Thank you, Mr. Chairman.